everyone. So my name's Kaara and I'm a PhD candidate from the University of Wollongong, and I will also be presenting this on behalf of my supervisors, Prof. Liz Halcombe, who's actually presenting in another session, and Dr. Maura Stevens. So what does impact on nursing students' attitudes, perceptions and preparedness to work in primary healthcare? There has been increasing demands for primary healthcare services over the recent years, and this is mainly due to an aging population and the growing burdens of chronic disease. Sustained shortfalls in the primary healthcare workforce as health practitioners in this area, including nurses, approach retirement age, place pressure on the Australian primary healthcare workforce. Adding to this problem, it has been reported that 90% of the Australian population seeks some form of a primary healthcare service annually. Yet the highest full-time employment rates for the nursing workforce remain in the hospitals. Although attention has been given to the exploration of primary healthcare nursing roles, there has been limited focus on the recruitment of new nurses to this sector. Available research have so far focused on the employment of conditions of current Australian primary healthcare nurses, reasons from transitioning from acute care to PHC, experiences with this transition process, and strategies to retain the existing primary healthcare nursing workforce. 30 years after moving from the hospital-based training model, nursing education has now been firmly established in the tertiary sector in Australia. But in terms of undergraduate nursing students' preparedness to work in primary healthcare upon registration, significant research have so far focused on clinical areas such as critical care, aged care, and mental health, with primary healthcare receiving far less attention. Factors that influence graduates' choice of clinical specialty in other areas have also been looked at, but perceptions of undergraduate nursing students towards primary healthcare, as well as their intent to work in this area, have not been extensively explored. It is therefore crucial to investigate the appropriateness and adequacy of educational preparation of undergraduate nursing students before they graduate to address the growing demands of the primary healthcare sector and the community that needs it. Thus, the aim of this literature review was to critically synthesize available literature about how undergraduate coursework shapes nursing students' perceptions of and preparedness to work in primary healthcare. This literature review was informed by the 5-step methodological framework by Whitmore and Naffel 2005, which involved a clear identification of the problem, an auditable and rigorous search strategy, a comprehensive evaluation of the primary data collected, interpretation and critical analysis of these data, and the synthesis and appropriate representation of the findings. An electronic database search was performed for papers that were published between years 2008 and 2018 in Scopus, Science Direct, CINAHL, and Medline. Pluis et al. 2009 scoring system was used to appraise the methodological quality of papers. An inclusion and exclusion criteria were developed and followed to streamline paper selection and ensure that studies included were most relevant to the topic of interest. So from the initial search, we yielded almost or just about over 400 papers, and we streamlined it to 12 papers at the end. And a constant comparison approach was used to synthesize the findings. And these papers that we reviewed came from countries such as UK, Canada, USA, Australia, and New Zealand. So, like I said before, 12 papers met the inclusion criteria, and 3 themes were identified from these included papers. These are curriculum, knowledge and attitudes, and career intention. The first theme revealed that the current undergraduate nursing curricula remain acute care focused. Some universities avoid delivering primary healthcare content on purpose due to beliefs that undergraduate nursing programs should prepare students to work in acute care. As such, primary healthcare concepts are often just embedded within health units that are covering broader topics. Barriers to primary healthcare content delivery were identified, and these include limitations around clinical placements, lack of primary healthcare academics, tensions in embedding discrete units of study, and students' expectations. Gaps exist in nursing students' knowledge of primary healthcare. Although nursing students have an overall understanding of the societal importance of primary healthcare, they underestimate the value that PHC and community nursing has and the profession itself, seeing this as the least relevant in their undergraduate training. Various factors can influence students' knowledge and attitudes towards primary healthcare. These might include their place of birth, geographic location, and age, as well as the perceptions and clinical placements they are exposed to. Negative attitudes towards primary healthcare exist among students, and these include views such as community health nursing as not real nursing and is seen as an easy way out, primary healthcare limiting opportunities to practice crucial nursing skills and reduces potential for advancements, a low status job and is more fitting for older, more experienced nurses, and that community nurses do not engage in complex clinical procedures like hospital nurses, which we all know are very untrue. 2 papers have reported that less than a quarter of those student participants had the intention to work in primary health care. Demographic factors to career intention were explored, in the papers included, but a notable finding was that female and older students are more inclined to want to work in primary health. Clinical placement, enrolling institution, and specific placement location were other extrinsic factors that impacted career intention. Employment conditions also contributed to student nurses' intention to work in primary health care. For instance, students who considered salary and flexibility in working arrangements were more inclined to work in primary health. But in saying this, however, Bloomfield et al. 2018 reported that students who valued workplace support, including supervision and transition programs, were less likely to desire to work in primary health care. So how do all these findings come together? And what do they actually mean? Well, this integrative review revealed that preparation for nursing students to work in primary healthcare remains inconsistent and that current undergraduate nursing curricula remain acute care focused in preparing students to work in acute care settings. The inadequate exposure to primary healthcare principles and practice contributes to low career intentions to work in primary healthcare among students. Therefore, accreditation bodies should collaborate with clinically relevant persons, that is, us, nurses working in primary health, as well as higher education institutions in the development of a revised, more relevant undergraduate nursing curricula. This should aim to appropriately represent the diverse mix of the primary healthcare sector and expose students to these areas adequately and appropriately through pre-registration training. Future research should focus on strategies to challenge misconceptions around primary healthcare and the primary healthcare nurse role to further expand this workforce and meet the needs of these requiring long-term and integrated care. Since they included studies that investigated perceptions of students were focused either in community health or public health or primary healthcare sector as a whole of society approach, attention should also be invested into investigating perceptions and preparedness of students to work in other areas of primary healthcare where this might be overlooked. In this way, educational preparation, practical training, and workforce issues are addressed at a micro and a macro level approach. The gaps found in this review has led to the development of my PhD project, exploring the preparedness of final year undergraduate nursing students to work in general practice. The findings from this presentation was a summary of the literature review paper, a part of this PhD project, currently under review in a peer-reviewed journal. But only just about 2 days ago, I was able to publish an article in the World Health Organization about this project. So it's great that the larger governing bodies are, increasing attention. They're becoming more attentive to us and what we're saying, particularly now that we're approaching the Year of the Nurse 2020. And just lastly, augmenting the visibility and allure of this sector through increasing collaborations between higher education institutions and us nurses working in the field, so to speak, is crucial. It is through persistent advocacy to make primary healthcare a clear and viable pathway for undergraduate nursing students that we can progressively meet the needs of this expanding healthcare area, address the growing demands experienced by current primary healthcare nurses, and consequently meet the increasing needs of the aging community. Thank you.